If you already have these pesky jowls or you're just starting to see them, well, I'm here to tell you that massaging them or willing them away is not going to work. My name is Dr. Swati Khan and welcome to my YouTube channel. I am a cosmetic dermatologist out here in California, and jowls are one of the biggest cosmetic complaints that I see in my office. So let's talk about treatments that would actually help. Why do we get jowling? Jowling essentially refers to the sagging or drooping of skin kind of below our jawline, and it can extend to the skin underneath our chin as well. We usually start noticing it in our mid to late 30s, and then it just kind of continues from there. Like all aging processes, the reason we get jowling is multifactorial. So first of all, we get bone loss. And so this is bone loss along our mandible, which is our jawbone, bone loss along the maxilla, which is kind of this bone around our oral cavity. We get orbital bone loss, we get temporal bone loss. In addition to the bone loss, we also get atrophy of the muscle. So individual facial muscles start losing their muscle mass. On top of that, our deep fat pads, which are these fat pads that are kind of deep into our skin that give our face that youthful appearance. Well, those fat pads also start atrophying, and that is combined with drooping of superficial fat pads. We've talked a lot about fat pads extensively in my previous YouTube videos on hyaluronic acid fillers. Lastly, we also lose collagen and elastin, which contributes to overall sagging of our skin. So why we get jowling is multifactorial, like most of the aging processes. Due to all of these changes, our youthful upward triangular face becomes a downward triangular face, with jowling being one of the first signs of aging. And because there's so many reasons that contribute to it, it makes sense that we would have to do a combination of treatments to help. So let's talk about some common treatments that people try at home. Does facial massaging actually help? As I stated before, jowling is due to bone loss, fat pad loss, muscle atrophy, collagen and elastin loss. So you can't really massage more bone into your jawbone, and you can't really change the shape of your face. But massage doesn't hurt, and it's obviously free. What it tends to do is that it helps with circulation, and it tends to help with puffiness. So when you massage, you're aiding the lymphatic drainage of your face. Initially, as you depuff your face, you temporarily look better, but then, your face goes back to its original state. The results of a facial massage are not permanent. This is the same thing with gua sha or jade roller. It just helps with lymphatic drainage, but it's not going to restructure the anatomy of your face. What about facial yoga? I see a lot of TikTok videos like this one talking about facial yoga and how that has helped them to reverse age or to maintain their youthful appearance. Is this true? Well, there was a small study from Northwestern that looked at about 32 patients, and they were given a 30-minute daily or alternate daily program of facial yoga. This was done over 5 months, and after 5 months, it showed a modest improvement in the mid-face volume, and the mid-face is what we consider here. So sure, you can try facial yoga, but just don't expect to get these amazing results from it. Theoretically, can facial yoga make your wrinkles worse? Because we technically use Botox to soften these wrinkles, especially like on your forehead, the glabella, around the eyes. We use Botox there to soften those lines caused by muscle movement. And we don't have any studies that compare certain types of facial yoga over another. So theoretically, facial yoga could potentially worsen some lines and may give you a modest improvement in your mid-face volume or your lower face volume. What about microcurrent devices like the Nuface? I have been seeing so many ads for Nuface. Nuface is basically an at-home device that is fairly expensive, and it sends microcurrents of electric energy into muscles, causing your muscles to gently be stimulated. The company that makes this device also claims that it helps with collagen and elastin stimulation. So I think that Nuface might help a little bit with superficial tightening, but it's not going to get you deeper tightening, which is why we have jowls in the first place. We need deep tightening to help jowls. I usually recommend, saving your money for in-office procedures that actually help. What about these LED light waves, like the solar wave that I have here? Do these actually help with tightening? Not at a deeper level. The most that these LED light therapies do is that they may help a little bit with some of the sun damage and some of the textural changes of your skin, but the treatment doesn't penetrate deep enough to be able to cause significant tightening. By the way, if you're finding this video helpful, please share it with your friends and family as I am trying to grow my channel, and don't forget to hit the subscribe button below. Also, if you have any questions or comments about jowling or any of the treatments that you have tried at home that have worked, please let me know and comment below. Let's move on to in-office procedures, which actually help more than at-home things that you can do. Now, I do not perform facelifts, and if you have significant jowling and very severe skin skin laxity, then facelift is the gold standard. Sometimes though, even with a facelift, it's very hard to get tightening of the medial jowls that would be present right here. And as you continue aging after a facelift, these medial jowls are often the first things to come back. So it may not be to the same intensity as it was before, but there isn't really a permanent cure to jowls. Maybe at least not until we can change our DNA. However, there is a new device that can cause significant tightening without needing a facelift. So stay tuned as I talk about that as well. The main treatments I do in my office are mainly non-surgical devices or non-invasive devices that can perform tightening at different depths. The first type of device is something that uses heat from an ultrasound machine to cause tightening, and these are called high-intensity focused ultrasound or HIFU devices. Now, there are subtypes of ultrasound devices that we use, and I'm not going to go into the science behind all of these subtypes. These ultrasound devices are like Ulthera, Sofwave, or Thermage, just to name a few. These treatments use ultrasound energy to deliver heat underneath the skin. They do not injure the top layer of the skin, so this makes it safe for all skin types. There are no needles used with these technologies. These devices heat the tissue 1.5 to 4 millimeters deep. This allows for tightening of the deeper parts of your skin, including not only the SMAS layer, which is a layer that encompasses all of your muscles, but also deeper layers of collagen. There is a lot of fear that delivering heat so deep can get rid of some of the fat that you need, and this is not always true. If I go 1.5 millimeters deep, that's not deep enough to cause deep fat pad loss, which is the fat pad we're worried about. We want to keep the fat within the deep fat pads. Superficial fat pads, if we dissolve a little bit of that fat, it's actually okay because those are the fat pads that kind of droop. And so if we can tighten these fat pads, that actually results in a more improved and lifted appearance. The reason fat within the deeper compartments is dissolved is because the operator of the device may not understand anatomy, and they're using the device and letting the heat penetrate deeply where it should not be deep. Like all cosmetic procedures, as I've said many times, don't sell your face to Groupon. While these devices may seem harmless and not as risky, it's very operator dependent, and the results that you see are operator dependent. My office has over 10 different kinds of these devices. So we have Sofwave, Thermage, Forma, Ulthera, etc. And I use the device that I need for that particular kind of patient. I will deliver heat into the deeper parts of the skin, especially on the lower face if needed. I can deliver it superficially, like on the upper parts of the face, or choose to not deliver heat at all. For HIFU treatments to be effective, patient selection is very important. If you have mild jowling, these heat-based ultrasound devices can be pretty effective. But remember that collagen production is variable, so not all of us will get the same results. For patients that have more severe jowling, I usually recommend a facelift if they want more drastic results. But some of these patients, especially the ones that come to me, they don't really want a facelift. So we can still try these treatments to help tighten a little bit, but the results will not be as drastic as a facelift. Once a treatment is done, it's also important to understand that the results are delayed because collagen production takes time. I tell my patients to be patient. It takes a good 3 months to start noticing results, but the results do get better with time. Now, some people, after doing their first HIFU treatment, may need a second one, and that just really depends on personal preference and what results you want. The second type of tightening device is microneedling with radiofrequency. Now, microneedling alone can penetrate as deep as a device lets it, but microneedling alone doesn't contain heat. Microneedling with radiofrequency does contain heat because it combines microneedling with radiofrequency energy. This is then used to help improve skin texture and produce collagen. Morpheus is a popular microneedling radiofrequency device, and we're gonna abbreviate this to RFMN. There isn't anything special about Morpheus per se, but the company has just done a really good job of marketing. We have a similar device in our office that I like as well, and I use often for skin tightening. Again, it's not the device, but the operator that's important. RFMN also delivers heat, and as it delivers heat, it's also creating tiny injuries from where the needles penetrate. As I mentioned before, this is different than the ultrasound technologies that don't penetrate the skin. The needle injury plus the heat encourage collagen production. And if we use RFMN to deliver heat deeply into the lower parts of the face, we can help to tighten and even slim the lower face. However, this takes many treatments. So the cool thing about this device is that we can change the needle depth, which then changes the depth of heat penetration. Now, for deep tightening or those jowls, I still tend to use ultrasound technologies just because the way the heat is delivered encourages more collagen production. I feel like RFMN devices are better for more superficial and textural changes. I tend to actually use it more often for acne scars. A common treatment combo that I see online is using RFMN plus PRP or just microneedling with PRP. PRP is platelet-rich plasma, and that is derived from your blood. Now, it may help with healing, but it's not going to increase the tightening. So for me personally, like I said, I will use the ultrasound technologies for jowling or the deeper tightening, and then I will use the RFMN devices for more superficial skin textural changes and acne scars. Sometimes I will combine both if needed, but that's usually rare. So what about Botox? Sometimes jowling is worsened by what's called the platysma muscle, and this is a muscle that's a sphincter muscle that goes kind of around our neck and inserts into the muscles of the lower jawline. So in some patients who have a very active platysma muscle, it can actually pull down, causing a sagging of the lower face. So what we can do with Botox is we can weaken the platysma muscle as well as put a few units kind of along the lower jawline here. And this can actually help with definition of your jawline and improve the sagging appearance. By the way, if you do Botox injections for your masseter muscle, and this is a muscle that helps us with mastication, a lot of patients who have TMJ will benefit from masseter muscle injections. But if you do Botox injections here, sometimes it can actually cause the jowling because the skin, which is being pulled tight by this big muscle, is now a little bit more anterior. So it can either trigger jowling or worsen jowling, just FYI. If you want to learn more about how we use Botox, please check out this video that I have done, and it talks all about Botox. When we think of Botox, we also think of filler. Now, filler doesn't lift, but if we can put filler in certain areas of the face, we can help to volumize deep fat compartments which have lost their volume, and we can sometimes redrape some of the superficial tissues to then improve the sagging appearance. Additionally, we can also mask jowling by putting filler under the jowl. So basically, if we put filler on the jawline, behind the jowl and then into the chin in front of the jowl, we can actually mask the jowling. In younger patients, I also like to do sculptra, which is a polylactic acid, as well as PRF or platelet-rich fibrin. These are two types of fillers that help to stimulate collagen. And so that's the kind of filler that I actually use in my face. And over time, when we do these different kinds of collagen boosting treatments, we can delay jowling or we can decrease its appearance. If you want to learn more about the 3 types of fillers, please check out these 3 videos on how I use fillers in my practice. When we think of lower face jowling, this is also associated with neck laxity. So usually we treat, the lower face and the neck together. So make sure you hit that subscribe button because my next video is going to be on how I approach neck aging. Kybella is another treatment for jowling. It is made of a molecule called phosphatidylcholine, which is the same molecule that your gallbladder makes to help digest fat. We technically use it for fat underneath the chin, but we can also inject it superficially into the jowls. However, you have to be pretty careful when you're injecting the jowls with Kybella because there is a nerve called the mandibular nerve, and that nerve runs pretty superficially along the jawline. So if that nerve gets affected by Kybella, which is dissolving the fat around that nerve, then you can get temporary paralysis of the muscle. So you can have a slightly crooked mouth. Usually this gets better with time. I have personally never seen it, but the person that's injecting Kybella has to be aware of anatomy and techniques to help minimize this risk. The problem with Kybella, and even though I do use it in my practice, it just causes a lot of inflammation. And that's because when we inject this molecule into the fat to help digest the fat, the part of your immune system called macrophages, they then come in. They're like the garbage disposal cells of your immune system. They come in to help digest up all this fat. Well, as they're doing it, it causes inflammation and swelling of the area. So most people have pretty significant swelling of the treated areas for about 2 weeks. Now, I do make a special formula of Kybella for my patients to help reduce the swelling and inflammation, but it's still there. Additionally, it takes multiple treatments to see results, and results are also delayed just because it takes time for the cells to get rid of all the digested fat. But the fat that you lose is a permanent fat loss unless you gain weight. What about lasers for jowling? Well, laser is just a broadly encompassing term for multiple treatments, but there is no one laser that does everything. So we have many different kinds of laser, and each laser targets a particular chromophore, which means like, certain ablative lasers, which is what we would normally use for skin tightening. They target water within our skin to then help generate heat, which then causes tightening. Ablative lasers can sometimes help with the superficial and static lines that can kind of happen here, or those accordion lines that can happen. But ablative lasers have very long recovery, and they're not suitable for all skin types, meaning somebody like me is not the best candidate for an ablative laser. So I tend to use ablative lasers a little bit less than some of these ultrasound technologies, which can help with deeper tightening, which is kind of what we need for jowling anyway. Threadlifts are another option. A threadlift is when we insert these thick barbed threads underneath the skin. These barbed threads are made of a similar polymer, similar to what we use for dissolving stitches for surgery. So for example, when I do skin cancer surgeries, I put stitches underneath the skin to help close the skin together. And these stitches are made of a monofilament polymer, and this is similar to what the threads are made of as well. That means the threads do dissolve with time underneath the skin. As the threads dissolve, they induce collagen formation. Now, some people think that the collagen formation induced is of normal collagen. However, I beg to differ. I think that threadlifts induce a lot of scar collagen as well, which can help with tightening. But if you ever want to get a facelift in the future, it really makes the job a lot harder for a plastic surgeon if you've had threadlifts done in the past. I also don't think that threadlifts last that long. So on social media, when I see these befores and afters on threadlifts, those befores and afters are usually taken either right after the treatment or a month after the treatment. But when you follow that patient out, 6 months after the treatment or a year after the treatment, their skin has fallen back to normal. Threadlifts are also not suitable for every patient. Patient selection is really important in general for when it comes to any of these treatments. But I have found that patients who have a heavier face type, they're not going to be the best candidates for threadlifts because their skin is just too heavy, and gravity, none of us are immune to the effects of gravity, so gravity will eventually take over and you go back to your baseline. So just like fillers, I use threadlifts sparingly. I actually use fillers more than I use threadlifts. So these are some of the more common treatments that we use for jowling, and I often have to combine multiple treatments like Botox, fillers, and a tightening device to create a more cohesive look. So if you found this helpful, please remember to share this video and subscribe below. As I mentioned earlier in this video, there is a newer device that can cause significant tightening and give you results like this one. This device is called Ellacor, and I made a whole video on Ellacor, so make sure you check it out because it's really one of the best treatments I've seen so far to help with jowling and lower face tightening. So thank you so much for watching this video, and I will see you in the next one.